David K. Williams, and I'm the CEO and chairman of a software company.
Which one?
It's called Fishbowl Inventory. We do inventory management software.
How amazing. So tell me your experiences with stem cell therapy.
Well, it goes back to watching a gentleman in the gym who was in a brace. I didn't really know who he was. I knew I'd seen him in the gym, and he was in a brace, and then like a week later he's without a brace walking, and then a week later he's pushing plates, you know, 300 or 400 pound plate, you know, on this sled. I finally went over to him. I said, "I'm Dave," and he said, "I'm Randy." I said, "How did you recover so fast? What happened, and how did you recover so fast?" And I can't remember the exact injury he had, but he said, I had stem cell injections. And I said, "Well, you know, I've heard a lot about that, and I've got some issues." And I said, "Who do I talk to about it?" He said, "Me."
Oh, really?
I did not know who he was.
Mm-hmm.
So he said that he offers seminars and other things to inform people. And I said, "You know, I've done enough of my own studying. Watching you heal is all I needed to see.
Wow.
So when can I come down and have it done?" I didn't need any more convincing than that.
Okay, so clearly you go to the gym quite a bit.
Every day.
Very fit, lift a lot of weights. What did you do to yourself?
I was in a four-wheeler accident about 14 years ago. And I tore 3 of the 4 ligaments from 60 to 20% in my shoulder. The bursa sac was busted. And then over time, there's bone spurs, and had a partially torn bicep attachment to my shoulder. And I lived with that because I didn't want to have surgery.
Right, you just figured.
I went to the surgeon, and he said, "You have to have these surgically repaired." And I just said, "I just do not want to go through 6 months of this, maybe a frozen shoulder issue, and all that stuff. I'm just not willing to. I'm not there yet."
Right.
Because I was still kind of functioning.
Right.
And so I just adapted to the pain and what I could and couldn't do in lifting.
Really? So that, I mean, this accident affected this thing that you love to do every single day.
And not only that, like sleeping. I had to have a pillow at night. It would hurt, it would ache. You know, if I stretched the wrong way, there'd be a sharp pain, and just all those issues that were every day.
Yeah,
I just got used to having them.
It was impacting your life.
Well, yeah, more so than I realized until now I've got it fixed. I didn't realize what I was giving up until now what I can do.
Right. So tell me what the treatment was like.
You know, I didn't really know what to expect other than it's just an insertion of stem cells. So I go in there and I'm sitting down and there's a needle stuck in, and the woman says, I said, "Well, is that like to numb me?" And she says, "No, I just did it."
That was it.
That was it. I didn't really feel anything other than...
It didn't hurt?
She was maybe in 10 seconds, 15 seconds with the little needle. Couldn't feel it.
An injection, like getting a shot.
Just right in the back of my shoulder. So easy. I didn't see any of it down. I could hardly feel anything. And she says, "You're done."
That's it.
That was it.
Okay, so immediately afterwards, how did you feel?
I don't know about immediately, but I would say the next day I could start to feel some relief.
The next day?
The next day I felt less pain, less constant pain. It's almost like a heavy dose of Advil hit me and took away a lot of the just chronic pain. I think, was it just in my head?
Right.
But no, I wasn't expecting it.
Right.
So the very next day I could feel things happening. It's not like my shoulder's good and my knees aren't quite there. It's like I have new shoulders and new knees. Tell me where I can get that, anywhere else where I can go to get that. And really not have any off time. I really never took off time. Some of the other people around here said you may want to wait a few weeks and let it heal. And I was telling Randy, I know my body really well, and I'll kind of do what it can do, and if it starts to hurt, I'll stop, whatever you know. I'm the best judge of my own recovery. And so it was amazing. It was amazing to me. And so people who need to go in to get shoulder surgery, like I was traditionally I would have had to do, you're in a sling for 4 to 6 months.
You can't work out. You lose muscle tone.
Totally. The recovery from that if you don't have frozen shoulder, is at least a year, year and a half, 2 years to get back. And I get immediate, and there's no recovery. And it happens, you start to recover immediately. I mean, where do you, it's like fictional.
Yeah.
That's what I tell people. I said, it's like something I'm reading in a book. I'm going, oh, I wish this really were true.
Right.
It really is true.
It's like science fiction, but it's
yeah,
real.
It's really true.
Well, thank you so much for sharing this with us. It's really very heartening to hear these real, very dramatic success stories.
Yeah, it's exceeded my expectation by maybe 400 or 500%.
Wow.
I'd have been happy with just not having pain and being limited in its use. I'd still been happy.
Wow.
But to have full use and no pain.
Hi, I'm Thurl Bailey, ex-professional basketball player, played 16 years professionally, and I was pretty fortunate in my basketball career. I didn't have a lot of injuries, and post-career days, I still am very active, training a lot of youth in basketball, from youth to college to players that have aspirations to play pro ball. So I'm always in the gym. I'm still very active, and a lot of my peers who have retired have already gone through knee replacements and are dealing with some of the other things that come with the pounding of your body. So I decided about 4 months ago to get stem cell injections in my knees. And a lot of it was because I wanted to just prolong my healthy body. I had some little aches and pains, but a lot of it was for prevention and just to extend some of the health benefits that come with it. So I did that. They told me to take about 7 weeks off, and I can tell you about the 4th week was when I really started to notice something different. I felt a little bit lighter on my feet. I didn't have any aches and pains. And then about the 6th or 7th week, I was sure, I was totally sure it was the stem cell injections that really gave me a lot of my mobility back. I can still dunk at the age of 56. Hopefully I can prolong that until I'm 70 years old. But I've been extremely pleased with the injections, and I recommend them for people who are looking for those kind of benefits that I felt. So obviously check with your doctors, but I am very pleased with my results, and I can probably still dunk on you right now. So don't test me. It's been really good for me, and I feel fantastic. Not the kind of fantastic that would bring me out of retirement, but the kind of fantastic to know that I can keep up with my kids as I teach them how to play the sport that they love, but also in general. At 56 years old, I feel very active, but very good, going on long walks and jogs. So if you're feeling those things, get out and get it done.
Any side effects from your injections?
No.
Any risk?
Oh, well, there's always a
Right.
risk anytime you're
Right.
injecting anything into,
Right.
there's always the risk of infection and,
Right.
and that sort of thing. But I did not have any of those types of detrimental side effects.
Right.
And it was I would say it was very simple. It was a 5-minute procedure,
And here you are.
and here I am.
So you're able to play golf?
I was able to play golf. I've been able to hike, walk, go downhill. I tend to use a walking stick just for a little extra stability. And if I'm doing something really vigorous, I'll use just a sleeve support, a support, just for a little extra, stability. And that's all I've needed really now. Initially I used an orthopedic brace to help push that alignment into
Right.
better condition. And after 3 months, the alignment had gone from that V shape to a parallel.
Oh, wow.
And that was just amazing to see.
And you could actually see this on the
See it on
x-rays.
X-ray,
Well, there's your proof. I mean, besides you feeling good, there's your
Right.
proof.
Yeah, yeah, the X-ray was amazingly different. To go from, like I say, a bone on bone and it was kind of like this shape to this shape, and that was dramatic.
That's remarkable.
Yeah, it really was, and that was one of the questions that others had asked. Does stem cell correct a bone on bone situation? And so I gave the clinic here permission to show my X-rays,
And yes, it does.
yes, it does. At least it did in my case. So.
That's wonderful.
I think this process has been about 3 months for me in this round. And again, little background, I tried my own stem cells, and then I went with the placenta stem cells, which is this current treatment. And I got to be honest, this one has taken me to another level. It's probably been about 3 months since the injections into the knees. And before, I had stiffness, I had constant soreness. I would have to put ice bags on my knees after work. So honestly, I haven't even thought about the pain in my legs. It's rare that I get a lot of stiffness or soreness, and there's more of a strength that's come back into my legs, and a little bit more confidence obviously comes back with that. And I don't think about it as much as I once did. And I think that's probably for me the key. When it's constantly on your mind, your constant focus is pain, and it's nice not to have that constant reminder. It's nice to have some calm in both my right and left knees.
Well, I guess a lot of my injuries, I had high ankle sprain, stress fracture, MCL bruise, ACL bruise, MCL tear, and that's just the lower part. I can go all the way up to the top with the elbows, and it just keeps going. I had pinched nerves. One time I just had them to shoot. They shot my back up just because I was spasming one time, just so I can play. So it's a lot, you know, because we wants to be on the field, and they made a way so we could be on the field. So.
What brought you out? What made the pain get better?
A mutual friend introduced me, told me about stem cell treatment. Yes, and he was real good friends with Dr. Pierce. And I heard about it. I heard him talk about it. He set up the meeting for me, and he started explaining to me, you know, because they weren't gonna cut me open because they said I don't need it, but he told me that you don't have to get cut open. It's a treatment it's a shot.
So tell me about I mean, it's sort of fascinating.
Yeah.
Tell me about the procedure and, like, did it hurt? What did it feel like? Run through it for me.
For me, it didn't hurt because I was used, but you know, the needle just kept going and going to the part. But he showed me what areas it was hitting. When he took them out and they finished, they felt kind of loose. It was like, well, I was like, oh, so I put my knee things on to seal it up and everything. But 24 hours, I was no pain. Yeah, I almost kissed him, but I'm gonna keep him. But I gave him the biggest up because I had no pain. To this day, I have no pain. I can bend, I can run, I can do just about everything I need to do, and working in the yard doing wifey dues. I could just do everything. I'm not laying in the bed, and I just couldn't believe it.
Wait, take me back. So
Okay.
you were literally confined to your bed. You were in a wheelchair.
Yes,
He gives you these shots.
yes,
24 hours later?
yes,
Really?
yes.
How long ago was that?
6 months ago.
And you still feel great?
I feel great.